friends, today I'll talk on clubbing of fingers. Almost 1 month back I have posted a video on clubbing of fingers, and regarding that I got few emails. They have wanted to know from me what can be the cause of clubbing. One of my subscriber, he asked that his son is having clubbing, and he has sent me one photo also, and he asked what can be the cause of the clubbing. So I thought in that video I have explained what is clubbing, what are the stages of clubbing, and how to examine a patient of clubbing. But here I'll detail about the causes of clubbing, so that you can understand that what are the symptoms you are having, or how you can correlate with the disease, and you can also understand that actually what type of disease you might be having. So let's start, friends. Clubbing is swelling or bulbous enlargement of the distal part of finger or toe. Usually it involves nail and nail bed. It doesn't involve the skin area or the rest of the finger. It involves only the distal part. Usually this clubbing include like there is loss of angle or between the nail and nail bed. There is increased curvature of the nail, and lastly pulmonary osteoarthropathy. This is the last stage of clubbing. In earlier stages there will be changes only in the nail, and the later stage, you can say in the last stage, there is swelling and there is tenderness of the distal part and the distal joint of finger. There can be erythema, or there can be swelling or drumstick like appearance of the finger. Now I'll tell you the diseases which cause clubbing. The first one is most important. This is bronchogenic carcinoma, also called lung cancer. In lung cancer, this clubbing occur, and by seeing this clubbing of finger, we sometimes suspect lung cancer. But yes, if your child is having this clubbing, then please don't think of lung cancer, because he is not a smoker, and there is very less chance of having lung cancer in for a child. If it is a small child or is an adolescent, please don't think of lung cancer. If the person is a smoker, he is a chronic smoker, and he is having cough for long time, expectoration or hemoptysis like blood coming out through mouth, chest pain, breathing difficulty, all these symptoms if they are having, then a chronic smoker, then we can think of lung cancer. Other cancer in the lung like mesothelioma, then pleural fibroma, this usually pleural tumor. So in that case, patient can have clubbing. Now come to infections. Some infections of lung can cause clubbing, like bronchiectasis. Bronchiectasis is bronchial dilatation. You can understand like bronchus is we inhale the air through bronchus, and there is small branches of bronchus in the lung. This when these bronchus get dilated, the small branches of bronchus get dilated, then these bronchiectasis occur, and there lots of secretion, mucus, this get deposited in the dilated bronchi, and patient usually comes to doctor frequently, and there is frequent admission to the hospital because of repeated infection in that deposited mucus or secretion. This bronchiectasis can be two types: congenital and acquired. Congenital bronchiectasis means the person is having this bronchiectasis since birth. If a child is presenting to doctor frequently with frequent infection of lung and lots of expectoration and clubbing, then we can think of bronchiectasis which is congenital. Usually cystic fibrosis is a disease which present with congenital bronchiectasis, and few other symptoms are there. Now acquired bronchiectasis is when a person develops bronchiectasis in later life, like if he is having some infection of lung, pneumonia or tuberculosis, then after the treatment of pneumonia or tuberculosis, then the person develops some sequelae, can develop bronchiectasis also because of fibrosis. These two are bronchiectasis, and in these cases patient can have clubbing of finger. Next is lung abscess. Lung abscess is, like, you can say, pus in the lung. If there is a cavity or hole in the lung and there is pus deposited in that, you can say this is lung abscess. In lung abscess, the person can have clubbing, but there will be lots of other symptoms like fever, lots of expectoration, patient can have chest pain, breathing difficulty, loss of appetite, all these things. So in lung abscess, it is treatable. Lung abscess is usually treated with conservative treatment, like medicine will be sufficient, very rarely surgery. Next is empyema. Empyema is pus in the pleural cavity. What is pleura? Pleura is the covering of the lung. And outside covering of the lung, if there is deposited pus because of some infection, then it is called empyema, and empyema is also treatable, and sometimes it is treated with medicine and conservative treatment, and sometimes surgery is needed, though it's rarely. So these three infections I have already told you. These three infections are treatable completely, and very interestingly, after the treatment of these infections, when patient get cured, then patient clubbing also reversed. I mean, the clubbing disappeared. Next, I'll tell you, that is other lung conditions like interstitial fibrosis, where there is fibrosis of the lung and there is decreased functional capacity of lung, and AV malformation, arteriovenous malformation. This is also congenital. So these conditions are in the lung, and these causes can cause clubbing. Next is condition in the heart. Congenital cyanotic heart disease. If a small baby or small child is having heart disease since birth, and moreover if it is cyanotic, you must have heard of hole in the heart. Like many people tell in the layman term, like there is a hole in the heart since birth. If there is a cyanotic congenital heart disease where patient usually have hole in the heart, you can say, in that case patient can develop clubbing from childhood itself. And after the treatment of cyanotic heart disease, this clubbing is totally gone. So this is a treatable condition. And subacute bacterial endocarditis. This is also an infection of heart, infection of valve in the heart. There patient can develop clubbing. Next is condition in the abdomen. First is hepatoma, like which is also called liver cancer. There you can find clubbing. In that condition, definitely there will be some symptom of liver, either loss of appetite, frequent infection, frequent admission in the hospital, jaundice, all these things can be there, and pain in the right hypochondrium, this can be there. The next is cirrhosis. Cirrhosis is almost, you can say, a stage where liver cannot function properly because of destroyed liver tissues, and there is fibrosis of liver, so liver cannot function properly. That is cirrhosis. In that condition also patient can present with loss of appetite, jaundice, or frequent infection, then weight loss, all these things can be there. So this is cirrhosis. In these two conditions of liver, there can be clubbing. And another is inflammatory bowel disease, including ulcerative colitis and Crohn's disease. These are inflammatory bowel disease, I mean disease of intestine. There will be indigestion problem, and sometime altered bowel habit, bleeding, sometimes bleeding in the stool. These can be symptoms. So these are causes under the diaphragm. So I have already told almost most important points about clubbing, most important causes of clubbing. Now last one is, When there is no other causes found that why the clubbing is happening, in that case we call it idiopathic. Means there is no cause till now, no cause established. If any person, any patient is there where we cannot find any cause, we term is as idiopathic clubbing. And another one is familial. There is a tendency of clubbing running in the family, I mean hereditary, so that also can be a cause of clubbing. So that's all about the causes of clubbing. I have tried to cover almost all the important causes of clubbing. Thank you for watching this video, and keep liking and keep subscribing. Thank you.